Dr. Anna Lembke says, one day a patient came to my clinic. His name was David. I asked him, what brings you here today? He replied, my problem started in my second year of college. That is when I decided to visit the university's mental health services office. I asked him, what is your issue? He said, I suffer from constant anxiety, so much so that it started affecting my body. I would sweat, my heart would race, and I constantly felt afraid. My biggest issue was speaking in public, especially in front of strangers. I believe that is the root of my anxiety. I reached a point where I avoided any courses that required presentation because I was afraid of looking stupid or sounding like I don't know what I was talking about. Of course, this is a natural feeling that most people experience. Many of us are afraid of public speaking, especially in front of people we don't know. But David didn't see it that way. For him, the anxiety was unbearable. That is why he sought help from mental health services. David says, I met with a psychologist and explained my situation. He gave me a test to complete. Dr. Anna noticed David finished the test in just 5 minutes. Even typically takes 45 minutes to complete. This shows that David was struggling, but the psychologist based his conclusion solely on the test. The psychologist told him, you have ADHD and generalized anxiety disorders. You need to see a psychiatrist to get medication. So David went to a psychiatrist who prescribed 2 medications, one of the ADHD and another from anxiety and depression. Here Dr. Lembke faces the comment, a student comes in complaining about normal anxiety when speaking in front of others, low self-confidence, and poor grades. Aren't these all things that most students go through? And yet medication was prescribed immediately without addressing the root cause. Anxiety often stems from a lack of confidence, and a lack of confidence means a lack of knowledge or skills. This means what the student really needs is self-development, not medication. She adds, we're facing a crisis of our time, the rush to medical solution. Then she shares some statistics. More than a quarter of Americans use medications like antidepressant. Among children, more than 10% are on a psychiatrist medication. In Iceland, the percentage is also above 10%. In Australia, it's 9%. And in countries like Canada, Denmark, Sweden, Portugal, and even South Korea, the rates are also high. In Germany, the use of antidepressant increased by 46% in just 4 years. Dr. Lembke continues, notice that most people using this medication live in developed countries, enjoy comfortable lives. I want you to focus on this point. An extremely comfortable life can make you more vulnerable to this kind of addiction. She then returned to David's story and says he began using this medication and felt they helped him to calm down. He would take them before any exam or presentation. Gradually, he became dependent on them. He was fully addicted. 15 years later, he came back to me saying, I live on these pills. I can't go without them. It's affecting my personal life and my marriage. Dr. Lembke explains, David's real problems wasn't drug addiction. It wasn't even anxiety. The issue runs deeper. We are facing a crisis of escaping pain. We escape work because of the tough paths. We drop out of school because of the difficult subject. We avoid learning new skills because it's slightly hard. We refuse to work and become burdens on others simply because the path is tough. Escaping pain is the real problem. She emphasizes we must learn to embrace pain. Don't run from it. Don't seek pleasure just to avoid it. Face it. Adapt to it. Know that it exists and will always exist. Accepting it is more important than fighting or trying to erase it. Train yourself, my friend, to do the things you don't like, because often the things we avoid are exactly what make the real difference.